This is the new second seal, or the second generation LMA, which incorporates a second seal, which you can see there. In other words, you have one seal with the larynx, and the second seal is with the GI tract. The second seal has the great advantage of providing access to the GI tract and also acting as a very accurate safety device, because every time the mask gets displaced, you get a substantial leak from the drain tube. And I think that's much more important, especially when you're doing long procedures where there is a good chance that the laryngeal mask might get displaced. The best way to demonstrate that is, first of all, to remove the safety tag. The safety tag is there because these are air transported, and you don't want gas to expand in that and burst the balloon. The best way to deflate it is to put it on a flat surface like that, and as you deflate it tightly, you pull backwards on the inflation line till it's deflated tightly, and you get a good shape, as you can see there. The lubricating jelly is always placed on the posterior aspect of the laryngeal mask, and thereafter insertion becomes very easy. You can either leave the head in the neutral position, or you can put it into the extended position. You place the tip of the mask up against the hard palate, you lubricate the hard palate, and then just slide it in till it reaches its natural position. Before you fix it, you check the distance from the teeth to the fixation tab. If this is more than 3 centimeters, then the size is probably too big. And if it's flush against the teeth, the size is too small. You inflate the cuff. Having done that, you have two options. You can then ventilate the patient using the ventilation device. And here the safety device comes in. If for some reason the mask gets displaced out of its proper position, each time you apply positive pressure ventilation, you get a purse seal, and you'll immediately get gas coming out of there. The best way I find to keep an eye on that without having to listen is to actually paste a little bit of KY jelly to form a column there, and you leave it in place. So anytime the mask is displaced, that column flies out, and you know that you've got a displaced mask. So that's the essence of the safety of the second seal. And of course, if you have any need to access gastric contents, it's quite simple to just put this in and go straight in.